good afternoon, everyone. And welcome to our Tuesday, March 25th, 2020 press briefing. I am Dr. Val Arkush, Chair of the Montgomery County Board of Commissioners, and here with my fellow commissioners, Vice Chair Ken Lawrence and Commissioner Joe Gayle. Also here with Dr. Brenda Weiss, the Administrator for our Office of Public Health, and Dr. Al Wong, Regional EMS Director. So we continue to have a very rapidly evolving situation here in Montgomery County. Since our March 24th press briefing, we've had 60 positive cases, new positive cases of COVID-19 in Montgomery County, which brings us to a total of 219. And I do just want to emphasize again that as more testing has become available in the county for about now the past 10 days, we do expect and will continue to expect to see an increase in the number of positive individuals here in the county. These positive individuals are from 27 municipalities, 4 of which are reporting their first cases. And those 4 are Ambler Borough, Lansdale Borough, Schwenksville Borough, and Trapp Borough. These individuals range in age from 5 years old to 81 years old, and you can see the municipal breakdown of these new cases on our map at montcopa.org/COVID-19. The age brackets for this group. There is 1 in the 0 to 9 age range, 1 in the 10 to 19 age range, 9 individuals in the 20 to 29 range, 9 individuals in the 30 to 39 range, 11 individuals in the 40 to 49 range, 13 in the 50 to 59 range, 10 in the 60 to 69 range, 3 in the 70 to 79 range, and 3 in the 80 to 89 range. 25 are female, 35 are males. 2 are hospitalized, 8 are at home, and 50 are unknown, meaning we are still tracking down information on those individuals. I'm also saddened to confirm that a second Montgomery County resident has lost their life to COVID-19. This individual was an 84-year-old male with underlying medical conditions who resided in Abington Township. And on behalf of all of us here at the county, I extend our heartfelt condolences to this gentleman's friends, family, and loved ones. So today I want to give you another picture of social distancing in Montgomery County. I'm going to ask Commissioner Gayle to just step off for a second there. So this is from Unicast. It's a Unicast toolkit, and if you want to look this up yourself, you can go to unicast.com/COVID-19. And this is an effort to help us understand the efficacy of social distancing initiatives. If you go to their website, they have a map of the entire United States, and you can click on each state, and then you can click on each county within each state. So this is Montgomery County. And it starts back here, February 28th, March 1st, where life was something that most of us can barely remember at this point, I think. Here in the county, we got our first notification of 2 individuals that were considered presumptive positives on March the 7th. And you can kind of ignore these case numbers. They don't track them quite the way that we do. So you can see shortly after March the 7th, the average mobility of people in Montgomery County started to go down. And this data goes through March 23rd. Through March 23rd. And you can see that we've really come down substantially. We noted that March 23rd, during that day, Governor Wolf announced that the stay-at-home order would go into place that evening at 8 o'clock. And it does seem like there might have been a little bit of an uptick of people going out and doing some last-minute errands. So I'm really looking forward to seeing the data now that we're a couple of days into our stay-at-home order. We certainly when I drive from my home here to the Emergency Operations Center, I see many, many, many fewer cars out on the road and fewer people out. So hopefully this number will continue to drop down. But what this represents from back in late February, early March, until March 23rd is about a 55% reduction in average mobility of people in Montgomery County. And this is based on cell phone data. So interesting, good to see. I hope we can keep that graph going down even further. So kudos to everybody who is complying with the orders to stay at home. This is absolutely the best thing that we can do to help decrease the spread of COVID-19 in our county. Now, in the last few days, I've received a handful of reports from county residents about ethnic profiling of Asian residents in Montgomery County. I want to express my personal commitment, that of my fellow commissioners, and your county government's steadfast and unwavering support for Asians and Asian Americans in our communities. Neither our county government, District Attorney Steele, or our local law enforcement will tolerate any attacks on anyone in our community. I want to emphasize that residents of our Asian communities, or any community, should call or text 911 if you feel threatened. If your phone is connected to a Montgomery County cell tower, you can text 911. We also have language lines immediately available, so lack of fluency in the English language should not be a barrier to calling for help. You should not hesitate to come forward, either make a report in person or reach out by phone. We are here to protect everyone. In addition to all of the charges that law enforcement has available through the criminal code, such as harassment and terroristic threats, local law enforcement is also able to charge ethnic intimidation, which occurs when someone assaults another or damages their property with malicious intent toward their race or national origin. This is an additional charge available to police officers, and they won't hesitate to charge it if the facts and evidence warrant it. Thankfully, the reports of intimidation have been few, but one report is one too many. We will beat this virus by working together as a community, not by falsely blaming any individual or group. By sticking together, 6 feet apart, we are Montco strong. I want to give a quick update on our community-based testing site, which continues to be up and running successfully since last Friday. I want to thank again Temple Ambler, Upper Dublin Township, and the Pennsylvania National Guard Medical Unit, and the numerous county departments that are assisting in providing support, both at the site and in other supportive roles. The site remains open by appointment to individuals meeting the criteria that can be found online at www.montcopa.org/COVID-19 under the County Testing Information button. When you click that, there's a drop down, and one of the choices is register for a test. When you click on that, before you start the registration process, you will see the current list of criteria, which is unchanged from yesterday. The site is open from 10 a.m. to 6 p.m. daily as testing supplies allow. Due to the limited number of tests available, tests will be reserved for the higher risk categories of individuals that you can find on our website. Generally healthy individuals who have mild symptoms and no underlying medical conditions should remain at home and self-isolate. You do not need to be tested at this time. Criteria may be further relaxed or enhanced based on the future availability of tests. We've received a handful of questions about the Montgomery County Correctional Facility. Currently, there are no positive cases among inmates, and there have been no COVID-19 related deaths in the Montgomery County Correctional Facility population. One correctional facility staff member who returned from an out-of-state trip tested positive for COVID-19. Contact tracing is complete within the correctional facility. 5 close contacts have been identified. None are inmates. All are asymptomatic, but in an abundance of caution, they have been tested and we are awaiting the results. These 5 individuals are in isolation at home. The correctional facility is taking measures to mitigate the potential spread of COVID-19. The correctional facility has declared a state of emergency operations and is closed to the general visiting public, attorneys, and law enforcement interviews. Alternatives have been made available. However, administrators, inmate service counselors, and supervisors are visiting sections frequently to answer questions and provide information to inmates and to personnel. The correctional facility has updated their pandemic plan and are aggressively sanitizing, providing staff and inmate education on social distancing, and taking the temperature of all staff entering the facility on a daily basis. The prison maintains an ample supply of N95 masks, gowns, goggles, surgical masks, gloves, sanitizing chemicals, and cleaning supplies. All new inmates remain in quarantine for 15 days before being placed in the general population. There is medical screening for all food handlers, and all package deliveries and mail are being sanitized before opening or distribution. The correctional facility's healthcare partner, Prime Care, has been working with the correctional facility on mutual pandemic planning policies. Prime Care provides the highest level of prevention, education, communication, and safety for inmates, the correctional officers, and the Prime Care employees that are in the correctional facility. The correctional facility holds weekly phone calls with Prime Care and the Pennsylvania Department of Corrections to review plans and make any necessary adjustments. As I've mentioned previously, we have urged the courts and district attorney to take steps to limit the introduction of new inmates into the correctional facility unless absolutely necessary for the public's safety. For further details on these efforts, I refer you to court administration. And with that, I will turn over to Commissioner Lawrence.
First, I would personally like to fully support what my colleague, Commissioner Arcos, said about ethnic intimidation or threats against our citizens of Asian descent. There is never a time for hatred and discrimination in our society, and there should certainly be none now during a public health care crisis. And I would also ask people to be kind to all the people who are continuing to work during this crisis so that we are able to get food, medicine, health care, and other life-sustaining services. They are leaving their homes each and every day and expose themselves and their families to COVID-19 for all of us. We should be grateful, we should thank them, and remember that the anxiety we have, they have every day because they are not staying at home. Food insecurity was an issue here in Montgomery County before COVID-19 and continues to be, and I'm going to give a report on some of our efforts around that from our Monco Anti-Hunger Network. At this time, no MON member food pantries have terminated operations, but many have schedules that are changing, so please check the website for updates and call the food pantry you intend to use before visiting to confirm their hours. You can go to the website www.moncoantihunger.org. Many food pantries across the county are getting more traffic. Those in Norristown are seeing the largest numbers, some serving 2 to 3 times as many people above the norm per distribution. Businesses with food to donate should contact the MON administrator through the website homepage, and there's also a donation, a COVID-19 response fund can be made, and it's appreciated as well. And people who are interested in volunteering should register at RSVP of Montgomery County. Now I'd like to highlight some of our businesses that are making a very valuable resource for us during this COVID-19 outbreak, and that is hand sanitizer. Boardroom Spirits, a distillery located on West 3rd Street in Lansdale, is giving away 4 to 5 ounces to anyone who needs it. All they ask is that you bring your own container. They've also been providing hand sanitizer to the local police and first responders. You can visit OBrien Spirits website at obrienspirits.com for their hours. The sanitizer is free, but they do ask that you bring your own bottle and that you consider buying a bottle of two while you're there. And in our county seat of Norristown, 2 great businesses, 5 Saints Distilling and Crazy Aaron's Thinking Putty, have also teamed up to produce hand sanitizer. Their first batch was dispatched to 10 police departments in Montgomery County yesterday. And for more information about securing hand sanitizer from them, please call 610-784-0603, or you can email sanitizer, SANITIZER, at puttyworld.com. I'll turn it over to Commissioner Gayle.
Good afternoon. I am Montgomery County Commissioner Joe Gayle, and today I would like to provide an update on actions taken and resources available to help sustain our local economy. For the life-sustaining businesses that are still open through this crisis and may need additional workers to meet heightened demands, there are workforce development programs and resources available to you. The Pennsylvania Career Link provides recruitment and online job posting assistance through the PA Career Link website. Employers can find people who are available and looking for employment. Some of these opportunities may include individuals looking for jobs in the healthcare industry, delivery drivers, and essential retail employees. For example, you see that Amazon, that's commonly in the news, is actually looking for employees. Locally, we're trying to do the same and help fill that gap with employers and people searching for employment. Additionally, funds are still available to help support the on-the-job training for new employees as well as training for existing employees. To contact the Pennsylvania Career Link and learn more about these services, call 610-270-3429 or visit pacareerlink.pa.gov. Again, that telephone number is 610-270-3429. We realize that small businesses are suffering most from this pandemic, and we are working on ways to bring them relief. The U.S. Small Business Administration Eastern Pennsylvania District Office is holding daily webinar training sessions on the Economic Industry Disaster Loan Program. These webinars will help businesses understand who is eligible for Small Business Administration disaster loans, what information you will need to prepare and file a disaster loan application. And these webinars also include question and answer sessions devoted to answering questions that small business owners may have. These webinars began yesterday and will continue through Friday, April 3rd. They are offered Monday through Friday, and each webinar starts at noon and concludes at 1:30 p.m. I happen to have a friend that participated in this webinar session this afternoon, and they found it to be very useful, so I encourage others to take advantage of this resource. For additional information about these webinars, please call the Small Business Administration District Office. You can contact them at 610-382-3062. Again, to contact the Small Business Administration District Office, the telephone number is 610-382-3062. So we will continue to update those looking for employment and those looking to hire, and any other loan programs or resources available to help sustain our local economy during this challenging time. Thank you very much.
All right. Happy to take questions.
The death in Abington, do you know if there were any underlying health issues or any?
There was, yes. As I stated, this gentleman did have at least 1 or 2 underlying health issues.
Was he in the hospital when all this happened? Or was
He did pass away in the hospital. I'm not actually sure which one, but he was in the hospital, yes.
So we have been hearing for weeks, even before the virus came to the U.S., that it's really the elderly and those with underlying health conditions. But as I do a rough total here, my math may not be perfect, it looks like more than half of what you announced today are people outside of that framework. the younger people, the 20-year-olds, the 30-year-olds that have tested. Is that telling you that they're not getting the message and they're out there still doing things?
Well, so the question was, we see today's list of results, there were a number of younger individuals who tested positive. So remember that what we've been saying is that the vast majority of people who get COVID-19 will have mild symptoms. Some so mild they might not even know that they have it. It is the older individuals, those that are immunocompromised, those with underlying medical conditions, that are much more likely to end up hospitalized and have a severe course. Having said that, there are some younger adults who are being hospitalized, and we've seen that in our own data. I also have to remind you that these tests are all lagging several days. So some of these results are from our testing site that we put up on Friday, but more of them are from other sites, hospitals, other places that have been doing testing. So we will have a much better sense of the true impact of the mitigation strategies that we've taken in another couple of days, when hopefully people really been home kind of since the weekend and certainly since Monday, and people that have been tested since that time, will have a better sense. But the point here is that everybody should stay home. So whether you are young and healthy and much less likely to have serious disease, we need you to stay home so that our healthcare workers and our first responders and those in the high-risk categories don't get this disease and either negatively impact our critical workforce in our hospitals or put one of your grandparents at risk of very, very serious disease.
Lower Marion has 48 cases. Is there any theory on why it's so high there, or why Lower Marion seems to be affected so much more than other municipalities?
The question was noted that there's quite a few cases in Lower Marion Township. It's one of our highest areas, and we don't have a theory on that. Some of our early cases were there from individuals who had traveled for the most part, so it could just be that we just saw some spread there, some community level spread there before they even knew they were sick.
Is there a reason to be concerned in Lower Marion, or is it
No.
just, okay?
No.
You had mentioned 4 municipalities that had first cases today. They were Ambler, Schwenksville, Trapp, and I didn't catch the fourth one.
Lansdale?
Do we have any specifics on the 2 individuals in Trapp and Schwenksville, as in age, gender, or any of that?
We could pull that out for you. We used to go through each one individually, but now the numbers are too high. But if you want specific data, what we will give you is age, gender, the municipality that they reside in, whether or not they are hospitalized, if we know it. But because again, so many tests are coming in now, it's where there's a little bit of lag for us to get all that hospitalization information.
That's great, thank
Yeah.
you.
The ethnic intimidation you mentioned earlier, were these reports made to you all directly? Were they reports made to police? Have any of them gotten physical, or was it just people observed what they thought was this? If you can expand a little more.
I'd be happy to. So the question was about the ethnic intimidation that I referenced earlier. I am not aware of any police reports that have been made. However, this was reports to me of verbal slurs and other things like that. So I just wanted to reiterate clearly that we will not tolerate that in Montgomery County.
Those appear to be people then that are out that probably shouldn't be.
These were from a few days ago. They're from over the weekend.
Some pictures have started surfacing on social media in your neck of the woods, Colonial School District area, of the school fields, and I'm sure this is in other places, but these were sent directly to me, of people holding sports matches and things after hours, and we're hearing of townships struggling with what to do with kids going out in the evening and playing basketball. On one hand, they're hearing exercise. On the other, these fields and courts are closed. What do you say?
Well, the message is exercise with social distancing, and we have made that abundantly clear over and over again. When I get these calls, I suggest that they just take the hoops off the basketball backstops. That's the easiest way to stop a basketball game. If there's no hoop, it's kind of hard to play basketball. So, there's some relatively simple steps that municipalities and schools can take. It's really up to them at the local level to decide how they want to respond to that. But exercise is fine. you can be with a household contact or the people in your house, but if you're with anybody else, they need to be 6 feet apart, and it's really hard to play basketball 6 feet apart, so you shouldn't be playing basketball. And I've told my own kids that. We had a big fight about it last night. So I know how hard it is, but parents have to intervene, and the answer is no.
It's kind of an interesting point, like what about like playing catch, things like that? I mean, anything where you're touching the same item?
If it's with a household contact, it's fine, because if there's, virus in your household, it's already in your household. Playing catch with somebody not in your household, unless you're both wearing gloves on both hands, I wouldn't do it. And if you're doing that, you better take those gloves off very carefully. The safest thing is just not to do it. Teresa, so just so everyone knows, we've created a system where reporters could either email in or call in questions for us. So Teresa's going to read those.
A Montgomery County man said he called the health department, our health department, on March 12th to get tested for COVID-19 and was denied. He had mild symptoms and he was told to isolate at home. He decided the next day to drive to Delaware to get tested, where it was found that he was positive for COVID-19. And so people are asking, are there potential risks? What do you think about someone leaving their home after they've been told to self-isolate to go to another state and potentially stopping for gas or at a restaurant and infecting others in order to get tested?
So the message from day one has been very clear. If you are told to self-isolate, you should self-isolate, period. And I do just want to clarify one thing, as we've also said from the beginning, our health department does not actually provide tests. The role of our health department has been to answer questions and to advise people, and for people that believe they need tests, try to connect them to a location where there is testing being done. Back on March 12th, which was just 5 days in to this here in Montgomery County, hardly anybody was doing tests. So it was difficult to get tests at that time. As has been our position from the very beginning, if you have mild symptoms and you're able to care for yourself at home, you should stay home and self-isolate. And certainly if someone tells you to stay home and self-isolate, that is exactly what you should do. If you have more serious symptoms, have underlying conditions that might make you immunocompromised or otherwise at risk, you should definitely speak to your healthcare provider if you haven't already and follow their guidance. And then certainly if you have life-threatening symptoms, you should call 911. What we do not want is someone showing up unannounced at a doctor's office or clinic or hospital without them knowing that you're coming and that you have the symptoms of COVID-19, which, just to review, are a dry cough, a temperature greater than 100.4, and shortness of breath or difficulty breathing. Those are the prime symptoms. Teresa, do you have any other questions from the rest? Yes. Okay, terrific. Then, barring something unforeseen, we'll be here tomorrow at 3. Thank you.